So I'm standing on the 7th floor of Narayan Hridayalaya. It's a hospital in Bangalore, India. And I'm at the telemedicine unit and I see EKGs from all over the world coming on their computer screen. Now this is a hospital which does bypass surgery for $3,000 compared to $30,000 it costs in America. And I have this moment of reflection, much like Tom Friedman did before he wrote his book, The World is Flat. Could healthcare jobs and patients from America go overseas? So when I came back to America, I called up my editor at the Washington Post, and she thought it was a fabulous topic, the issue of medical tourism. Medical tourism is when patients go overseas for their medical care. A few years ago, my father had a toothache. His dentist in Boston said he needed a crown. He decided to wait until he was on holidays to India and get his surgery there. He saved $2,000. And you know what? My mom, she got a dental implant and saved $3,000. The Deloitte consulting firm estimates that 875,000 Americans went overseas in 2010. And the McKinsey consulting firm estimates that 75,000 Americans went overseas for inpatient hospital care. And the estimates are that this number will be growing at the rate of 20 to 30% each year. So initially, I was uncertain about the quality of healthcare one would receive in a country where the tap water is not safe to drink. So I talked with Devi Shetty. He's the pediatric cardiothoracic surgeon and the founder of Narayan Hridayalaya Hospital. He told me that their ICU has a nurse-patient ratio of 1:1. That's superb. Also, their hospital just received the JCI certification, which is equivalent to the JCO certification, which every hospital is required in USA. That's pretty good quality. So I talked with Dr. Arnold Milstein, and he said that most of medicine is acute illness and it would probably stay in America. However, the back end of medicine, such as radiology and labs, they're ripe to go overseas. Yet, there are barriers. Credentialing, regulations. You know what? All this time, I thought that healthcare was local. Now I wonder, is it? Read the piece in the Washington Post and you'll enjoy it.